Okay, so the next scenario we're going to discuss is a patient with a fresh cab. So many years ago, when some of the schools had developed this idea that they were going to take fresh graduates in nursing into the ICUs immediately, there was a situation where a nurse had a fresh cab patient. The patient went into a VFib arrest, and she started immediately to start CPR on the chest, as she was taught to do. But what happened was during that CPR event, she actually caused one of the sternal wires to go right through the patient's heart, and the patient died immediately. So that is why Alina has come up with this new protocol on how to do an arrest on a patient, or a VFib arrest on a patient who is a fresh cab. So the first thing that you want to do is if you are with the patient and the patient has had a fresh cab and he goes into VFib arrest, if you can get the defibrillator to him within 1 minute, you want to immediately start stack shocks. So you come over to the ventilator or to the defibrillator, select your joules. We would start with him at probably 250, whatever you want. You charge. Don't touch the patient.
Oh.
And then shock at that point. You're going to immediately recharge to 300. At this point, no one is doing CPR on this patient at all. We're trying to act upon his electrical potential that he has within him. And then everyone's clear, you shock, and then you immediately charge again to the 360 before anyone starts any CPR of any sort. Stand clear and shock. At this point then is when somebody's going to get on the chest and start CPR. So CPR on a fresh cab is very different. You want to do it to the depth of about the size of your card here, or your badge, or to a perfusion pressure of less than 60 if you have an art line in, or if the patient is intubated and on a ventilator and you have a CO2, you want to get their CO2 to between 10 and 15 with each compression. So as we know in American Heart ACLS, that you have adequate chest compressions based on the CO2 that you get out of the patient. So for any fresh cabs, you want to do a compression of CO2 to reach a level of CO2 of 10 to 15.